Was World Kidney Day, and this year the emphasis was preventing kidney disease in children. April 7th was World Health Day, and then the emphasis again was how to defeat diabetes, one of the conditions that can predispose to kidney disease. What indeed does it mean to say the kidneys are diseased? What are the preventions? Since prevention is always better than cure. But for those who eventually find themselves coming down with kidney disease, what are the treatment modalities that are available, especially here in Nigeria? Good evening, viewers and friends out there. Thanks for joining us once again. It is with all pleasure that I welcome you to your #1 health show on West African TV. My name is Dr. Ogenekeve Ogidigbe, and Lifeline reaching you from the Lagos Network Center of the NTA starts right now. With me in the studio is an authority when it comes to anything that has to do with maintenance and cure for the kidneys. He is a seasoned consultant nephrologist. He is an excellent teacher, indeed one of my teachers. He has served as the president of the Nephrology Society of Nigeria. He is actually the immediate past president, but currently the president of the Transplant Society of Nigeria. He currently also serves as the clinical director of the very distinguished St.Nicholas Hospital here in Lagos. Dr. Ebun Bamgboye, thank you for coming to the show.
Thank you for having me, and good evening, viewers.
So, kidney disease in Nigeria. A lot of people urinate, so everybody knows that there's that process by which people make urine, but some people might not know that the kidneys play the very important role when it comes to making of urine. But talking about kidney disease in Nigeria, before we go to other important aspects of the disease, it is important for the viewers to know what exactly kidney disease is.
I think to explain it, it might be best to actually explain what the kidneys are and the roles that they play. That way it makes it easier to understand what goes awry when the kidneys become diseased. Each individual has 2 kidneys, which are about the size of your fist, and they are situated in the back parts of the abdomen. And as small as they are, they actually take from the heart about a quarter, 20% of the blood flow that comes from the heart actually goes to the kidney. And that's a reflection of how important the kidneys are. The kidneys are responsible for regulating the amount of water you have in the body. So if you don't take enough water, you won't make as much urine. If you drink a lot of water, you make much more urine. The kidneys excrete the wastes of metabolism. So all the wastes, your urea, your creatinine, and other so-called middle molecules that the kidneys normally should excrete, you end up finding that when the kidneys fail, those tend to accumulate. The kidneys are responsible for control of your blood pressure. They're responsible for producing a hormone which stimulates your bone marrow to produce blood. They're responsible for regulating your acid-base balance. And they're responsible for regulating the levels of so many of what we call your electrolytes. So your sodium, your potassium, your calcium, your phosphate. Almost all the electrolytes in the body are regulated by the kidneys. So clearly, once the kidneys become diseased, you find that automatically almost every single one of these functions become impaired. So you are no longer able to excrete fluids as easily as you should. And that's why you find that one of the earliest signs of kidney disease is that the individual's feet begin to swell, particularly late in the evenings, and the face becomes a bit puffy. You find that the individual, when he passes urine, he finds that the urine becomes very foamy, almost as if you've put some detergent within the water and you've been stirring it. So if you have that, that sometimes can be a sign of some disease in the kidney. You find because all the wastes of metabolism tend to accumulate in the body, the individual now becomes very ill. He loses his appetite and very often vomits and might have very, pale, bloody, dark, smelly stools, which are a sign of what we call uremic stools. You find in those instances the blood pressure becomes very high. And the typical person with kidney failure very often has blood pressures that require sometimes as many as 4 or 5 drugs before you can control. And you find that almost every single part of the body, from your hair, which can become fluffy, to your toenail, becomes impaired or becomes diseased once the kidneys are not performing the role that they have been designed to perform.
Well, it sounds quite scary. I know the viewers out there are like, really? So the kidney disease can affect every part of the body. Now, before we go to throw more light on the symptoms, it is important for people to appreciate how common. Now, you're a professional nephrologist who have been in practice for quite some time, and you've been on different international platforms to talk about kidney disease, especially when it has to do with the figures. How common is this disease becoming in our environment?
I think that's probably, for me, is one of the most frightening aspects of kidney failure. Essentially, how common it is. I honestly believe that more people die from kidney failure than die from malaria, than die from even HIV, that there's so much fuss about. Because all these conditions, to some extent, with malaria, if you detect it, you treat it appropriately, the person recovers completely. But with kidney failure, particularly the chronic type of kidney failure, which by definition is 1, it's irreversible. Whatever you do, you cannot get it better. And 2, it is progressive. Whatever you do, it will get worse. You find that once an individual has been diagnosed with chronic kidney disease, all you can do is to slow down progression. It's inevitable that a time would come when that person would require some form of assistance or the other. Now, worldwide, it's been estimated that you get at least 100 new cases per million population. That is the incidence. And the prevalence, which is the total number of new cases you see in a year, plus the pre-existing ones, is about 400 per million population. So if you're taking a population of, let's make a conservative estimate in Nigeria of 150 million, just to make it easy to calculate, it means that you have at least 15,000 new people, new patients requiring some form of assistance every single year. And these are the ones that have reached the stage where they need some form of assistance. But in reality, worldwide, it's been estimated that at least between 10 and 20% of individuals, total number of people, actually have one stage of chronic kidney disease or the other. In America, where those studies have been done, they've actually gone into the community. They've examined every single person and estimated what the person's kidney function has been. And they found that between stages 1 and 5 of kidney failure, 11% of the population in America have kidney failure. Now, similar studies have been done here in Nigeria. They've been done almost everywhere. They've been done in Lagos, they've been done in Enugu, they've been done in Maiduguri. And we're finding that our figures are higher. In fact, the figures are closer to 20%. And that is frightening. It means that 1 out of every 5 individuals has one stage or the other of chronic kidney disease. And it's not surprising, because all the things that we know that can and do lead on to kidney failure are very common in our environment. Probably the 3 commonest would be hypertension. And we know that 1 out of every 4 Nigerians, adult Nigerians, 25% of adult Nigerians have hypertension. The older you get, the more likely. And in fact, 60% of individuals over the age of 60 would have hypertension. And unfortunately, only about 30% of those who have hypertension realize that they have it. And even of those who know they have it, only about 30% are on treatment. And of the 30% that are on treatment, only 30% are well controlled. So it's not surprising that hypertension is one of the more common reasons why people's kidneys fail. The second reason would be diabetes. And diabetes is another condition that is even becoming more common. Maybe 20 years ago, it was about 2.2% of the population. Recent estimates for Lagos suggest that within 20 years, the prevalence of diabetes has increased from 2% to almost 10%. It's now about 8.8% of the population. And what we're seeing is that it's increasingly becoming a now more common reason why individuals' kidneys fail. And the third commonest reason would, of course, be what we call chronic glomerulonephritis, which essentially is an inflammatory, very often immunologic damage to the kidney that results from chronic infections usually. And there will be infections such as hepatitis B. About 1 out of every 7 Nigerians are hepatitis B positive. Hepatitis C, about 5 to 8% of Nigerians are hepatitis C positive. HIV, roughly about 4% of Nigerians are HIV positive. So most of these chronic infections, the body's reaction to their presence often leads on to some immunologic reactions that ultimately leads on to damage to the kidneys.
So the body begins to build antibodies. For laymen, they're like soldiers of its own that goes to affect its own
And
kidney.
unfortunately, they damage the kidney. And to make it even more, poignant is the fact that for some reason, the average black person in the world is 4 times more likely to have kidney failure than a Caucasian. So if you look at populations in the world that have a mixed ethnic diversity, like in the US and possibly in places like in South Africa, you'll find that even though blacks in America constitute only about 15% of the population, they constitute well over 30–40% of individuals that have kidney failure. So for some reason, the black kidney is particularly prone to the complications of most of these conditions that we talk about. So if you're black and you're hypertensive, you're more likely to have kidney failure. If you're black and you have HIV, you're more likely to develop kidney failure from it. If you're black and you're diabetic, your kidneys are more likely to fail. So it almost means that you have a double whammy because hypertension is more common in blacks. And then if you have the hypertension, your kidneys are more likely to fail.
Well, these very scary figures, whooping figures. Some people might say 20%, it's a little figure, but that's, like you said, 1 in 5 in some of these cases. And then you have rightly mentioned some of the risk factors that can predispose black people to this condition. Viewers and friends out there, I'm sure you have been listening. The information from the experts have been quite straightforward. Kidney disease is something, in fact, kidney care is something that we should take more importantly. And then that brings me to interventions, sir. I know that you have done a lot when it comes to areas of intervention. You have pioneered some of the intervention mechanisms available in our environment. Now, before we go quickly to prevention, what is the picture like when it comes to intervention currently in Nigeria?
I think just before we go on to that, I hope you don't mind me taking us back a bit.
Oh, that's all right.
Because I feel that it's also important to mention a few other things which are within the
risk factor.
There are risk factors, but there are things that individuals can take control of to make sure that they don't develop kidney failure. And I usually would mention at least 3 of those. One is analgesic nephropathy. And you find that until recently, it was one of the more common reasons why Australians developed kidney failure. So if you take paracetamol, as simple as that drug is, and you abuse it, in fact, if you take 2 tablets of paracetamol 3 times a day, and you do it consistently for up to 2 years, your kidneys will fail. And there's an entity known as analgesic nephropathy. And you find the average manual laborer who at the end of the day feels a bit tired and
little pain.
He goes to the chemist and asks for what they call ashapo. He puts several tablets together and takes it like that every day. That person is courting kidney failure. Secondly, the use of bleaching creams. A lot of the bleaching creams actually contain heavy metal. They contain mercury. And you might say you're putting it on the skin, but enough of it is absorbed.
Well, sorry, sir. Well, that's an image of the kidneys. My boss was saying the kidneys are bean-shaped organs. So there you have that. Those are pictures of the paired bean-shaped organs that help to concentrate urine and filter it such that you can pass it out through the private parts. You were talking about...
So bleaching creams can lead on to kidney failure. And then the use of native herbs. I was reading an article recently by a team from Benin that looked at all the native herbs in Lagos. And they found that 100% of them contained organisms that would cause individuals to develop all kinds of infection. And many of them contained all forms of heavy metals, things like mercury, like copper, like zinc, all of which ultimately can lead on to problems with the kidney. So these are some of the things that are within the control of individuals. If you don't abuse native herbs, or you don't take them, if you don't use bleaching creams, if you don't abuse analgesics, you're not likely to develop kidney failure. I mean, hypertension, if you control it, is something that you can do. Diabetes, if you do get it and it's diagnosed and you go in and it's well controlled, also it reduces the likelihood of developing kidney failure.
Thank God you mentioned herbs. Well, that's a diseased kidney there on your screens. Now, agbo is something that not only Lagosians. The other day, my elder cousin was telling me, if you take one of this, the roots is so... I'm like, your kidneys. It seems to be preponderant, and for the demographic, the viewers out there watching, even the person from Ajegule and every other area of Nigeria, indeed West Africa, herbs are not good. The consultant nephrologist has just told you that all sorts, when they prepare these things, they do not go through any proper process, and then there is no dosing when it comes to the utilization.
In fact, in China, which is another area of the world where they have a very high prevalence of kidney failure, they found that many of them develop what they call Chinese herbal nephropathy. It's one of the most common reasons why people in Taiwan, Vietnam, China develop kidney failure. And they've traced it to the use of these native herbs. And that's even the ones that come from China. So you need to be careful, all these so-called herbal supplements. The fact that it's imported from outside the country doesn't make it safe. Yes. It's not any safer than the ones that are produced locally.
Let me not mention names. Well, sir, let's talk about the World Kidney Day. It was about children. And people do not know that, kidney, hypertension, all the diseases that have been mentioned, they most likely feel that these are diseases of adults. What is it with kidney disease and children?
Yes, children also do develop kidney failure. It is only that the things that lead on to the kidneys failing in children is slightly different from what happens in adults. In adults, like I said, the commonest would probably be hypertension and diabetes. In children, the commonest causes will be things that the child is born with. There's certain what we call congenital abnormalities that babies are born with. One of them would be what they call polycystic kidneys, in which for some reason, due to a developmental defect, the individual develops small cysts in the kidney, which eventually enlarge and ultimately damage the kidney. Then sometimes you have what you call a PUJ obstruction, where for some reason the pathway from the kidney, the tube that takes urine from the kidney to the bladder, gets constricted. There's a stricture on it. So urine is not able to pass. And then in males, sometimes they have what you call a posterior urethral valve. And all these things ultimately can cause an obstruction to flow of urine and cause the kidneys to fail. That's one. But two, they also tend to develop the chronic glomerulonephritis. And that's the second commonest cause of kidney failure in such children.
The infection-related?
Infection-related ones.
So why did it become quite important that a day like the World Kidney Day
should be devoted to children? I think the point is to detect it early, to prevent it. Now, most of these things I've mentioned, if they're detected early and you relieve the obstruction, the kidneys will not fail. And one of the things that we did in the hospital, St.Nicholas, was to go out to eventually 4 different schools and measured the blood pressures of all the children in the school, looked at their urine to see whether they had protein in the urine, and also did their height and weight to see whether they were obese. And it was frightening to see some of the results that we got. We got some 11, 12-year-olds whose blood pressures were as high as 180 over 120. We found some that already had protein in their urine, which in itself is a marker of damage to the kidneys. Now, all these children would have gone on through life and nobody would have detected it until they end up in kidney failure. But now that we've actually been able to observe this, it's quite possible that putting in the appropriate measures, it would be possible to slow down or even in some instances arrest progression. Make sure that the ones that have hypertension, their blood pressures are controlled. Those that are obese, you get them to lose weight. These are some of the factors that we know are recognized to slow down progression and prevent the individual from ending up requiring some of the interventions that I believe we'll be talking about.
Well, yes, we have to talk about interventions because having heard all of this, the viewers out there are saying, wow, is there any cure for kidney disease? How can this thing be managed to be able to save life?
I think the most important thing is to try and prevent it. Detect it early and prevent progression. So, and the only way you can do that is if you go to the hospital and get somebody to check you. I usually would advise every individual, usually by the age of 30 or 40. I think the common ones are the points at which individuals go on from primary to secondary school and from secondary to university. Most institutions will insist that you do some pre-admission medical exam. You find that many mothers and parents will say, no, there's nothing wrong with my child. Doctor, just sign it. I always refuse. I always insist that those children, I go through the required investigations, and you'll be surprised at how many are detected at that time to have, various abnormalities that control of which will prevent kidneys from failing in the future. So that's one. But more importantly, once you cross a certain age, make sure that when you go into hospital, you get them to check your blood pressure. Even if you go in with malaria, your blood pressure should be checked. Get someone to check your urine as well to make sure there's no protein in it. So all these things would help detect it early and slow progression. But once your kidneys fail and you end up at stage 5, which is the stage where the amount of function is inadequate or insufficient to sustain life, at that stage you need some more active interventions, and that would be where dialysis comes into play, either peritoneal or hemodialysis or a transplant. Now, dialysis means essentially the hemodialysis, which is the more common type that we find here, means taking the blood of the patient, passing it through a machine, which ends up cleansing the blood of the waste that
The waste products.
kidney is not able to excrete, and then returning the blood to the patient. But it's not something you do once or twice. It's something you're going to do for life. And each session of dialysis will cost anywhere between 20 and 30,000. Meanwhile, you need 3 sessions per week. So
That's quite expensive, isn't it?
So you'll end up spending about $500,000 every single month just looking after the kidneys to keep you alive. And that's why when the kidneys fail, probably the best option is to have a transplant.
Well, sir, because of time, let me ask more specific questions. You have done 156 transplants under your belt. Now, transplant, for the viewers out there, is getting a functional kidney through surgery to be able to replace the bad kidney. What has been your highest challenge with this transplant, sir?
The highest challenge had always been not the things that we thought. The initial concerns were whether we would find people willing to give kidneys, but no. You find that each individual presents with about 2 or 3 potential donors. It has been the costs of the procedure, which generally is beyond the reach of most Nigerians. And then even after the transplant, sustaining the transplant, because the medications that you need to prevent the body from rejecting the kidney are themselves quite expensive. And unfortunately, those drugs are hard to come by, and they're still subjected to all the tariffs that government imposes on the importation of most drugs. So there's a 20% drug levy which they have to pay, and that makes the cost of those drugs beyond the reach of quite a number of individuals who have struggled to put money together to do a transplant. So you find someone who's had a successful transplant. In our own series, the commonest reasons why those kidneys have failed has been from poor compliance. Poor compliance because the individual finds it difficult to be able to sustain the cost of maintaining that kidney, of using the medications, the immunosuppressives that will prevent his body from rejecting the kidney.
Well, the time is fast spent. I'm sure that we'll look for a way to reach you through another medium to talk more on interventions and then how people have come around this difficult costing in the past. Dr. Bamgboye, thank you so much for coming to share to our viewers all they need to know about, not all basically, but the introductory pattern, essential things they need to know about kidney disease. Viewers and friends out there, I'm sure you've learned a thing or two, but if you are forgetting everything, ensure not to forget to get to a good hospital to your health for your health checks. Check your BPs, check your blood sugars, and make sure that kidney disease never comes anywhere close to your family. Until same time next week, ensure to have a very wonderful time out there.
NTA Parliament is a dedicated 24-hour channel that broadcasts activities of the Nigerian Senate, Federal House of Representatives, and all the 36 state houses of assembly. You can watch NTA Parliament on NTA Star Times DDT platform. NTA Parliament, strengthening Nigeria's democracy.
It's a one-stop arena for everything called sports. A fusion of entertainment and unusual moments in the sports world. Whether it's a football season, an ATP tour in tennis, a heavyweight contest, or a Formula One Grand Prix. X-Sports, the show for the explosive sports lover. Learn from the world's top 10 on our countdowns. Know what and who is at the top of their game. Hear sport-loving fans on the street and feel their pulse. Get inspired as we unveil various sports legends. Feel the vibes on X Special and catch all of the amazing excitement. And on Sports Matters, get blown away by extraordinary moments. X Sports. Feel the fusion.
Your love is busting my brain. I'm in front of a moving train. What am I gonna do if I can't spend my life with you? My love for you is true. Baby, please be my boo. Be my boo. Baby, please be my boo. Be my boo. Baby, please be my the one that makes me tick. All 7 days of the week. You make my heart click click. Without your love, I'm sick. The one that makes me tick. All 7 days of the week. You make my heart click click. Without your love, I'm sick.
It be like you say, I don't just get myself on a major way. Baby, take the arrow. I'm not go for you. Baby, te necesito. You're spinning me round and round. I don't know which way to go. Te amo. Oh, baby, te amo. Te amo. Oh, baby, te amo. Te amo. Oh, baby, te amo. dead man.